The year is 2025. Maya wakes up before her alarm. Nothing dramatic happened. No pain, no emergency, no panic. Just a normal morning. But before she even gets out of bed, her health system already knows something's changed. Not something dangerous, not something urgent, but something early. A small signal, a pattern, a warning that would have been invisible 10 years earlier. And this is where the future of healthcare begins. Not in a hospital, not in an emergency room, not after the crisis, but before the problem becomes serious. Now, Maya, as you see, stands near the window of her apartment. The city is waking up. Lights comes through the glass, her wrist device activates quietly. A transport health dashboard appears in front of her. She sees sleep quality, heart rhythm, stress level, recovery score, inflammation risk. Everything is simple, everything is calm. No complicated medical language, no frightening red alert. Just a message. Says, "Good morning, Maya. Your body is showing signs of balance and resilience." At first, everything looks normal. Her sleep improved. Her heart rhythm is stable. Her stress level is low. But then she sees something else. A small notice. Early inflammation risk detected. Biomarkers suggest a mild increase in systemic inflammation. Recommendation? Consider a preventive check-in. Maya looks at it for a moment. She doesn't feel sick. She doesn't feel weak. She doesn't feel like something is wrong. And that is the strange part. You see, in the old healthcare system, she would probably ignore this. Because in the old system, you usually acted when you felt symptoms, right? You waited until the body became loud enough, until pain appeared, until something forced you to stop. But in 2035, the system is different. It does not wait for the emergency. It watches the pattern before the emergency. Maya taps the screen. She taps book check-in. And just like that, her day changes. Not because she's sick, but because the system caught something early. I'm Elon Lyman, and here we explore the AI economy. Not through hype, not through fear, but through what is actually changing. And today I want to do something different. Instead of only explaining the AI economy as I usually do, I want to show you one part of it through a story. The story of Maya, a person living in the year 2035. Inside a world where preventive healthcare has become one of the major AI native industries. Because when people talk about AI and healthcare, they combine both together, they usually talk about doctors being replaced, or diagnosis becoming automated, or hospitals becoming more efficient. But I think the bigger story is different. The bigger story is that AI makes diagnosis, monitoring, and health interpretation cheaper, faster, and more continuous. And when that happens, healthcare does not simply become smaller, it expands. It moves from reactive care to preventive care, from waiting for illness to detecting risk earlier, from treating problems after they grow to helping people act before they become serious. So let's step into that future, not as a theory, but as a real experience. So let's go back to Maya. A few hours later, Maya walks into a neighborhood preventive health hub. It's like a futuristic clinic, so to speak. It does not feel like a hospital. There's no atmosphere of emergency, no cold hallway, no feeling that something terrible must be happening for her to be there. It feels calm, warm, almost like a mix between a clinic, a wellness center, and a technology studio. A care navigator greets her, not with panic, not with fear, but with context. Maya is not treated like a case file. She's treated like a person who received an early signal. The system already knows why she's there. It knows her sleep patterns, her stress patterns, her movement habits, her recent nutrition data, her health history. But the care navigator does not simply let the AI decide everything. That's important. You see, the AI organizes the signals, but a human helps interpret the situation. Because in the future, healthcare is not only about data, it's about trust. Maya goes through a quick preventive scan. It, you know, it is routine at this point. Sensors collect information, AI systems analyze patterns, the scans check cardiovascular signals, metabolic markers, inflammation indicators, stress recovery, sleep related patterns. Nothing here is presented as magic. It is simply faster than before, cheaper than before, more available than before. And because it is more available, people use it earlier and even more. That is the important economic shift. In the old system, health checks were often occasional. In the new system, health becomes continuous, not because people become obsessed, but because the cost of monitoring has fallen. And when the cost of monitoring falls, the behavior changes. Now let's move behind the scenes. While Maya is going through her preventive scan, another part of the system is working. Not just AI, people, real people, a whole team, a preventive health command center. Daniel is one of the people working there. He is not a traditional doctor in the old sense. He is not waiting for patients to arrive after something goes wrong. His work is different. He coordinates prevention pathways. He works with remote care nurses, behavioral coaches, health data interpreters, AI assisted clinicians, community care coordinators, nutrition specialists, sleep and recovery coaches. This is not one job. It's a whole it's an ecosystem. And that is the point. When AI makes diagnosis and monitoring cheaper, it creates more health signals. When there's more health signals, someone has to interpret them. Someone has to prioritize them. Someone has to contact people. Someone has to guide behavior. Someone has to help people actually follow through because data by itself does not change a life. A warning by itself does not change a habit. A dashboard by itself does not improve health. People still need support. That is where the new industry appears. Daniel and his team look at Maya's profile. The AI has already summarized the situation. Sleep is improving, stress is lower than before, heart rhythm is stable, but inflammation risk is moderately elevated. The system does not say emergency, it says opportunity. This is a small window where action can still be simple. So the team builds a personalized prevention pathway, not a generic plan, not a PDA that nobody will read, not a like a one of those health recommendations that basically says sleep better, eat better, exercise, good luck, and we'll see you in the emergency room. No, nothing like that. This is more specific. Maya's plan focuses on sleep consistency, anti-inflammatory nutrition, light movement, stress regulation, follow-up monitoring. And the key is not just the plan, the key is the support around the plan. You see, because the bottleneck is no longer information, the bottleneck is behavior change. So let's go back to Maya. Later that day, Maya meets with a preventive health guide. The guide walks her through the plan, not in a scary way, not in a medical lecture, but like someone helping her understand her own body. The screen shows simple recommendations like nutrition, stress reduction, mobility, sleep, follow-up monitoring. Maya makes basically asks a question. So, am I sick? The guide answers carefully, no. That's the point. We're not treating a crisis. We're catching a pattern early. That sentence is the entire shift. We're not treating a crisis, we're catching a pattern early. This is the difference between the old healthcare economy and the preventive healthcare economy. The old system was built around reaction, the new system is built around anticipation. The old system waited for symptoms, the new system seeks risk forming. The old system focused on treatment, the new system adds prevention as a major economic layer. And this creates something much bigger than a new app. It creates a new sector. Because you see, once millions of people receive early signals, millions of people need help acting on those signals. That means new services, new clinics, new platforms, new coaches, new care coordinators, new diagnostic workflows, new behavior support systems, new insurance models, new employer health programs, new community health networks. That is how an AI native industry forms. Not because AI replaces everyone, but because AI makes something cheap enough that demand expands naturally. 3 weeks later, Maya is back in her apartment. But something has changed. Not dramatically, not like a movie transformation, no heroic music while she's throwing away all unhealthy food and becomes a different person by Tuesday. No, no, no. The real change is smaller. She sleeps a little better. She walks more often. She adjusts her meals. She gets reminders that feels useful instead of annoying. Her AI health assistant does not simply say be healthy. It gives context. Today focus on hydration. This week prioritize anti-inflammatory meals. Your sleep consistency improved. Your stress recovery is trending better. Small choices today, but stronger tomorrow, so to speak. That is the emotional side of preventive healthcare. It makes health feels less like a crisis and more like a relationship with your future self. Maya is not being treated because she collapsed. She's being guided because the system noticed early signals. And that changes, those changes, that kind of changes her experience completely, as you can see. She does not feel like a patient waiting for bad news. She feels like a person supported by a system designed to keep her well. Now let's zoom out. Maya is only one person, but in 2035 there are millions of Mayas, millions of people receiving early signals, millions of people getting personalized prevention plans, millions of people using AI supported health guidance. And around all of that, a new industry grows. Remote care nurses monitor people before they need urgent care. Health data interpreters turn raw signals into meaningful insights. Behavioral coaches help people follow through. Preventive clinicians validate AI recommendations. Community care coordinators connect people to local services. Nutrition specialists personalize plans. Sleep and recovery coaches support long-term health. This is the part many people miss when they talk about AI and jobs. They imagine AI doing a task, and then they think the economy shrinks. But often the opposite happens. And it happened many times all over again, during our history. It happened with internet, it happened with electricity. And if you take a look at every technological, even major technological change, that's exactly what happened. So AI makes a capability cheaper. That capability becomes abundant. Abundance creates new demand. New demand creates new work. The work changes. The roles changes. The value moves. But the economy does not simply become smaller. It reorganizes itself. In this future, diagnosis is cheaper. Monitoring is cheaper. Early detection is cheaper. So the value moves from only detecting problems to helping people prevent them, from medical information to human trust, from raw data to interpretation, from warning signals to behavior change. That is why preventive healthcare becomes a new economic sector, not just a healthcare upgrade, a whole new layer of the AI economy. Now let's step out of the story a little bit. What did we actually see? We saw a value migration. Before, AI diagnosis and monitoring were expensive, so healthcare was mostly reactive. You waited until something happened, then the system responded. But AI changes the cost structure. AI makes analysis cheaper, diagnosis cheaper, monitoring cheaper, pattern detection cheaper, personalization cheaper. And when these things become cheaper, they become more available. When they become more available, people use them more. And when people use them more, new demand appears. But the new demand is not only for more diagnosis. The new demand is for help. Help understanding diagnosis, help changing behavior, help preventing escalation, help coordinating care, help building trust. That becomes the new bottleneck. And where there's a new bottleneck, there is value. So the economic map is simple. AI makes diagnosis cheap. Health signals becomes abundant. Trust and care become scarce. Prevention becomes the new value. That is the AI economy pattern. And we can apply the same logic to many sectors. In education, AI makes explanation cheaper. So motivation and personalization become valuable. In media, AI makes content cheaper. So trust and taste become valuable. In software, AI makes coding cheaper. So integration and product judgment become valuable. And in healthcare, as you saw, AI makes diagnosis and monitoring cheaper. So prevention becomes valuable. This is why the future of work is not only about jobs disappearing. It is about value moving. And when value moves, new industries appear. So the story of our lovely Maya is not just a science fiction story. It's a map of what happens when intelligence becomes cheaper. The old healthcare system waited for the body to scream, so to speak. The new preventive healthcare system listens when the body whispers. And that small change creates an entire new economy, a new patient experience, a new workforce, a new set of companies, a new set of services, a new type of healthcare market. That is what I mean by the AI economy. Not just machines replacing people, but intelligence becoming cheaper, capabilities becoming abundant, and value moving to the next bottleneck. In this case, the bottleneck is not diagnosis. It is care, trust, interpretation, behavior, change, prevention. And that is where the new value appears. So if the story of Maya got you thinking, please drop a comment. I read everything. And just responding to the last comment that I received, that it looks like some people think that I'm an AI generated persona. That's not the case. I have everything. I even have five fingers on my hand. So I'm not an AI generated persona. I'm real for real. So please, comment, but comment in a little bit more constructive way, I will say. If you have any questions, any comments, don't hesitate to put them in the comment section. Thanks a lot for watching, and I will see you in the next one.